All right, so this is going to be a knee health and knee kind of rehab mobility workout and routine here. So first we're going to start with a backward sled drag. So personally, actually, this is the day that I did a mile of backward sled drag, but you can do any sort of length. It's really good to get a lot of blood into the quads and starting to strengthen them. All right, so after we do our backward sled drag, again, for at least a decent amount of time to get a lot of blood into that area, to start helping the healing process and help in the strengthening process. What we're going to move on to next is our SMR, our self-myofascial release, and there's going to be 3 areas that we're going to be working on. So as you see me doing a lot of my workouts, as you see me rolling out my feet, there's a couple of your muscles that actually come and attach at the bottom portion of your feet. So like your fibularis longus, your tibialis anterior attaches to that bottom middle portion of your foot. Your tibialis posterior, which doesn't cross the knee but can start affecting the knee a little bit through the ankle, that attaches at the bottom of your foot too, and so on, and a couple other muscles there. So what we're doing is we're trying to roll out and work on the soft tissue quality of your feet so that we can work on the quality of those muscles that come up and actually attach close to your knee and might pull on your knee to cause a little bit of pressure. But also we're starting to work on the downstream chain to make sure that all our foot and our ankle complex actually works to the best of its ability so that it's not necessarily causing any more knee pain. If we have a dysfunctional foot and ankle, our knee can often take the brunt of that dysfunction. So you'll see me perform a couple other foot and ankle strengthening exercises later on, and that's the reason for it. Not only do some of the muscles cross both the ankle and the knee, but they also, if we have a dysfunctional ankle, we most likely have a dysfunctional knee because that's trying to make up for that. So you'll see some of that. And so we're going to be rolling out our feet for between 1 and 2 minutes each side. So the next spot that you're going to see me roll out is my quads. Now, despite my crappy camera work, you can kind of see what I'm actually getting at there. So I have a quad underneath, I have a softball underneath my quad there, and I'm rolling all the way down from right just above my kneecap, all the way up towards my hip. What you see me doing there is I'm adding a little bit of motion to start to, again, work on that soft tissue quality in your quads and your hip flexor, your rectus femoris, which is also part of your quad there. But starting to work on that by actually trying to bend that knee a little bit whenever I'm on a sore spot, so I can start to get a little bit deeper pressure with that softball to get a little bit more relief. The quads tend to be a really, really tight spot on a lot of people. And since they attach on the kneecap, your 4 quad muscles come down and attach through your quad tendon to the top of the kneecap, which then goes through the patella tendon and attaches to the tibial tuberosity, which is the top of your tibia or your lower leg. When your quads are tight, they can actually pull on that, on your quad tendon and patella tendon, and pull your patella or your kneecap into your knee so that it's actually causing a lot of pressure on your knee. Now you also have cartilage that's on the back of your kneecap to help reduce some of that wear and tear, but if it's actually too tight, you can actually wear that cartilage away quicker and faster through just overuse, and poor use, or a dysfunctioning quad if it's too tight there. So we want strong quads and nice and healthy quads. And in order to help work on that health of that tissue quality, we want them to be nice and loose, so they're not pulling on that kneecap, not pulling up on that kneecap, pulling that patella into that knee to start wearing away at that cartilage. So I'm going to go 1 to 2 minutes each side. The last spot that you see you're going to see me roll out are my glutes there. So I'm in a figure 4 position, so that one foot is crossed over my other ankle, that one ankle is crossed over my other knee, and then I have the softball underneath the side, underneath the glute of the side that's crossed over. Now, the reason why I'm rolling out my glute in a knee health mobility workout or a knee health warm-up is because your glute will actually pull on your IT band, or your glutes attached to your IT band, and IT band syndrome or can affects a lot of people, and that's oftentimes the knee pain that people feel is on that outside portion of that knee. Okay, now your IT band can't necessarily be tight because your IT band stands for your iliotibial tendon. Okay, so it's a tendon. It's not or it's not a muscle in the sense that it can actually be tight or tighten up. Your nervous system won't actually tighten it up, but the muscles that attach to it can be tight, and then in turn it will tighten up that IT band, and then it could be causing pain. So if you have IT band problems, it's probably not the IT band itself that is the problem, and in fact it's the muscles that surround and attach to the IT band that are the problem. So your glutes are a very big muscle that tend to be tight on people that can pull on that IT band. So I'm rolling out my glutes in order to reduce that IT band pain down into the knee. Again, I'm going to between 1 and 2 minutes each side. Here you see me do 1 minute for all of these 3 rolling outs, but you could go between 1 and 2 minutes depending on the amount of time you've got. And if this is a warm-up, you can do 1 minute or 30 seconds to a minute. If this is a standalone mobility workout, then you can do 2 minutes if that's what you feel like. So now that we're done with our SMR, what we're going to be moving on to next are 2 different stretches. Our first stretch is the Bulgarian Split Squat Stretch that you see me doing here. So this is to stretch out our hip flexors and our quads. Like we were just talking about, having tight quads or hip flexors can actually cause structural damage to the knee over time, but it can also cause acute pain just because those quads and those hip flexors are too tight. So this stretch can acutely downregulate that pain syndrome. That's another reason why we did, or pain symptom. That's another reason why we did the rolling out before, and allow you to perform some actual strength training that could make some more permanent tissue change. These stretches will actually also open up your hips, and which is good because tight hips can cause dysfunction at the knee, just like how we talked about tight ankles or ankles that aren't functioning properly can cause dysfunction up the stream at the knee. Well, the opposite can also be true for the hips. If we have hips that are too tight, we're also often going to get that excessive motion through the knee that we should be getting through the hip, and could be causing knee pain over time, or currently acutely causing knee pain. So being able to have mobile hips will help reduce that chance of knee pain. Here in this workout, I'm doing 1 minute each side, but just like with the rolling out, you can do between 1 and 2 minutes each side, depending on the amount of time that you have. This next one is a modified pigeon stretch. Again, it's opening up the hip, and it's performing for the same reason that we were rolling out at glutes before. We're now getting a deeper stretch in that hip, in that glute with the pigeon stretch, and getting a little bit more mobility than we even got with the ball. It's kind of nice if you're going to stretch to maybe perform a little bit of foam rolling or some sort of self-myofascial release before you stretch, because you might so again, that'll help down regulate that area, so kind of reduce that resting muscle tone. When you then do that, sometimes you can get into an even deeper stretch if you stretch the same area that you roll out after that. So that's one of the reasons why we're performing the stretches second after the rolling out. But then, like we already said, tight hips can lead to dysfunction at the knee. So we're stretching the hips in 2 different planes that tend to be really tight on a lot of people, and that's with the hip flexor stretch and then moving on to this glute stretch. I prefer the modified pigeon pose just because it kind of works with my hip structure a little bit better, and it works with a lot of people's hip structure a little bit better, unless you're somebody who really practices the normal pigeon pose. Then I suggest you at least start with the modified pigeon pose to see how it feels. Then, just like we were doing the other stretches, I'm performing 1 minute each side here, but you can perform between 1 and 2 minutes each side depending on how much time you got. So this next one we're going to do is an active mobility exercise or strengthening exercise called the back to the wall tib raise. So what this is doing is this is strengthening our tibialis anterior, which is that muscle that runs down the front of your shin, okay? It performs the action that you see me doing, and it's called ankle dorsiflexion. So it's when you raise your toes up. Having a stronger muscle here will not only increase your ankle range of motion, which will help function and reduce dysfunction at that ankle, but also help strengthen around that knee and help provide support for that knee. So we need to strengthen the muscles around that knee in order to start providing it some support. So this is another reason why you then see me going to calf raises here. So these are called FHL or flexor hallucis longus calf raises. I'm coming up onto my toe and putting pressure through my toe as I come up. So this will help strengthen your toes, feet, and ankles. Both of these will help strengthen the muscles that surround the knee to provide that knee support and fix those ankles for you too. Now I'm going to be doing 25 reps of each. That gets a lot of blood into helps get a really good pump in your shins and your calves, which again can be very protective. We have dysfunctioning ankles because of shoes, and we need to strengthen our foot and ankles to help provide support for the knee. The next exercise we're going to be doing is performing a standing hamstring curl with ankle weights. This is going to work our ankle or our hamstring's ability to perform knee flexion, which is that movement that you see me doing there. And very specifically, it's going to work the short head of your bicep femoris, okay, which is an often forgotten part of the hamstring that people tend to not work as much. And again, if we have a weak portion in our structure, that's often going to be the part that's providing us pain and leaving performance on the table, whether that's performance in sport or performance in life. It's never good to be in a weak area, and we need to work knee flexion to work the very specific parts of the hamstring. I'm going to move right into ankle flexion with that ankle weight there. Hip flexion with that ankle weight there. Again, I'm going to be working the muscles that now kind of cross the front. As I mentioned, that your rectus femoris is a hip flexor that attaches to your inferior iliac spine or the front of your hip, and also goes down where your quads attach. Well, that performs both knee extension and hip flexion, and we don't want to be weak there either. So getting stronger in both of those will help provide support for that knee. This next movement that I'm going to be performing is called a TKE, or also known as a terminal knee extension. Now this is going to be working your quads. What you're going to be doing is when you come down and when I flex against that band, I'm going to be flexing my quads really, really hard and holding for a second. This is going to strengthen that vastus medialis, or that inside portion of that quad, what a lot of people know as that teardrop muscle, okay? Now, this is actually a spot that I was personally struggling with. After my first powerlifting meet, I was kind of having a lot of pain in my right knee due to my squat. It's kind of the heaviest that I went, and I was having a decent amount of tendon pain. And two things that really helped it were specific strengthening exercises for that vastus medialis, and also the reverse sled drags that we started this whole thing with. So what we're doing, again, strengthening that vastus medialis and those quads will provide support. So we've now done 5 total exercises to provide support for the knee, 2 that also help the ankle, and these 3 that work the hamstring, the hip flexors, and now the quads to work those muscles that surround that knee. So what I'm going to be doing is I did 25 each side for the hamstring curls. I did 25 each side for the hip flexion, and now I'm doing 100 each side for the TKEs. What this is doing is just getting a great pump. It's getting a lot of blood into those areas and working on the muscular endurance component with those high reps, but I'm also with these high reps working on the tendon strength and health. Tendon strength or health can be greatly increased through things like these high rep exercises, because since they have very poor blood flow, tendons need a lot of reps to actually get blood to the area, or get as much blood as you can around that area to provide those tendons as much nourishment as you can. So that's one way to help strengthen those tendons. There's other ways, but that's one of the reasons why we're doing a decent amount of reps on all of these exercises that we're doing now. Last thing here in this workout is a split squat iso hold. We're going to do 20 seconds each side and make sure that you perform it in a pain-free range of motion. So if it's really, really tough, go a little bit higher if it hurts a lot. Isometrics are great for tendon health. That kind of continual tension is really, really good for tendons to be healthy and to be strong. So performing different isometrics are really, really good, and also like being able to perform them for a really, really long time. Now, this split squat iso is kind of a basic way to get into a lunge position, which hurts a lot of people with knee pain. So again, perform at a pain-free range of motion, and this also will help develop strength there.